Today's video, some of the dumbest stuff that people say about TRT.
Welcome to this channel. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please subscribe and hit that notification bell.
Hey guys, Danny Bossa from the TRT and Hormone Optimization YouTube channel. Joined today with one of our more popular guests, Dr. Jordan Grant. How you doing, Jordan?
Hey, Danny, doing well. Thanks for having me back.
Cool. So as we mentioned, today's video is going to be some of the dumb, crazy, stupid crap that some people say in regards to TRT. We have a Facebook group and we created a list where everybody got a chance to chime in. And they all shared some of the really crazy, dumb, stupid things that they've heard. And we've got a pretty sizable list that we've put together here that we're going to go through. Before I get on with the list, I need to make one little comment. There are so many guys that come into the group and they come into the YouTube channel and they make comments. And some of these comments are basically just stuff like, everything you're saying is wrong. Where we will then say, you know, what was it specifically that was wrong? And then there's nothing. There's no response. Or what you're saying is dumb. Everybody knows that this works like this. And I'm like, okay, can you provide evidence that that works like this? And there's nothing. So to some of you smart asses out there who think that you're doing, you're being the cool guy to go calling out guys on that we do on this type of channel, without providing any evidence to support anything you're saying, you're just making yourselves look kind of dumb. Okay, Jordan and I love to know when we're wrong. We love to know when we're wrong, when somebody shows us a better way or the right way. And just to think that for all this past time, we were wrong. We love that because we hate being wrong. Okay, we want to only know the right stuff. So if you come onto the channel or the group and you say what you're saying is wrong and I can prove it, here's the evidence, here's the literature, here's this, here's that. And we look at it and say, wow, that guy's right. We just learned something. That'd be great. Now that's the right way to do it. But the problem is that most of you out there are making statements with nothing to back yourselves up with, and it just makes you look dumb. Okay, it makes you look dumb. That's one thing. And second of all, some of you guys come in, don't like the thumbnail, don't like the video, don't like what we're saying, don't like the guest, don't like the presenter, don't like the topic, and can't even really find even reason why it's dumb or why you don't like it. And then you'll just pick on the way the guest looks or the way the video looks or the way that I look. You know, I'll get comments like, oh, Danny's got a small neck, you know, so what does he know about TRT? Or look, Danny says he trains and he doesn't look like he's that big. So what does he possibly know? Or Jordan looks like this, or this person looks like that, or whatever. Like, guys, I'll be frank with you. I'm so busy with work these days that this channel is just, it's a hobby. It's a passion of mine. I clearly know I'm not working out 5 days a week. As you can see, I'm working out a couple days a week. I was supposed to do this big diet plan. It didn't happen. I'm just too busy. I still take the time out of my day to share what I can. Jordan takes the time out of his day. You know, on his time off, he's a super busy guy at work and he's got a wife, he's got a family, takes time away from there. So, I just don't get where a lot of this stuff comes from. If you have something valid to say, by all means, come in, chime in, provide some kind of evidence. But just to pick on the way people look or the video or whatever without anything else, just kind of silly. So I don't know if Jordan, you got anything to say about that? But
oh, I could say a lot, but yeah, I mean, that's classic logical fallacy 101. I mean, you just immediately. You can't dismiss somebody's statement because of how they look. You can't dismiss somebody's statement about even for other reasons that they might believe something else wrong. And they say, well, you believe this, so therefore you're wrong about that. And that's called the genetic fallacy. It's like saying, well, Hitler can't be right about trains running on time because he's Hitler. It's like, well, no, you can still be right even if you're an idiot about other stuff.
Yeah.
Exactly. Yeah, that's all I got to say about that. People see that. I mean, you can see in the YouTube comments all the time. Somebody just says you're dumb, or but appealing to popularity. Well, everybody knows that's not. You can't do that. You got to show it. You know, like I was telling you earlier. Like if I make a comment on a YouTube video that I might disagree with something, I'll politely say, "Hey, research shows actually this. You know, what do you think about that?" Or you know, maybe look into this. I mean, I don't just get on there and say, "Well, this is stupid." So it's just not.
Does it just make you look stupid?
Yeah, it does. So
yeah,
absolutely. But well, they'll always be there. They'll always have those people. That's fine.
And if some of you guys watching think that if I was to say, I'll use me as an example, I got jacked up on steroids, you know, so I had a freaking crazy physique. Would what I'm saying suddenly now be more believable? Are you going to believe me more just because I look a certain way? Because if you believe me just based on my looks, you might want to question what it is you believe, because you shouldn't be believing things based on the looks. You should be believing things based on the legitimacy and can these things be demonstrated. Okay.
Right.
So make sure you guys think about some of these things, especially a lot of you going to some of these other channels where you see the guy who looks like a supermodel. So he must be doing something right. Let me just take everything he says as fact. No, use some critical thinking, use some rational thought, and be skeptical of everything you hear, and then go look it up for yourself, right?
Look at that. Absolutely.
Like some of the stuff on this list. So one guy thought that, you know, the transscrotal cream that is very popular. One guy thought that if you would apply it to the penis, it would promote penile growth. Basically, you know, you want a couple inches, apply that cream on your willy, and then you can grow it into an Italian-sized willy within a short amount of time. Jordan, you're the urologist. I mean, you're an expert on willies, so you want to
be. And if that worked, we'd be prescribing it every day. We'd be a lot of happy guys. It would have already been discussed at all the conferences, and it just doesn't work that way. I think what the problem is, a lot of guys extrapolate studies done on children with like micro penis, which is a real thing due to like lack of hormone, lack of DHT. And of course, they've tried putting that stuff on different places on kids. It wouldn't matter whether they put it on the penis or not. If they give them DHT or give them testosterone, it will help the micro penis. I mean, you can't extrapolate that to humans that are past that stage of development. Where you put it, it's being absorbed and then goes in the systemic circulation. So, yeah, I don't have much more to say on that. It just doesn't really work that way. The penile skin, I mean, theoretically would be fine. It just, I mean, it's very similar to the scrotal skin, almost identical, but the scrotal skin has the dartus muscle in it, which causes, you know, we know shrinkage. I was in the pool, you know, all that stuff. And that's why it absorbs so well, is because of that vascular muscle layer. For anyone who's ever done scrotal surgery, the minute you cut into the scrotal skin, it bleeds like crazy. I mean, it's just super vascular. And I think that's part of the reason it absorbs so well, you know, down on the scrotum. But yeah, no, you can't grow a penis by putting cream on the penis. There are guys that I do think that if they've been without hormones long enough, they will see some shrinkage from lack of DHT and lack of androgen. And when they get back on, you know, TRT, whatever the fashion, whatever the form, they might notice a little bit of extra girth. It's not huge. It's just maybe a little more fullness. But I see that in guys that say they're castrated, like medically, for metastatic prostate cancer on Lupron injections. And they'll complain after, you know, a year, like, yeah, doc, I've lost a lot of size. Some of that is weight gain, where they're getting fatter from the, you know, they're just not as active. They don't feel like doing anything. They don't have any hormones. The skin starts moving around the penis and they think they're losing size. So you have to be careful with that, because I'm kind of notorious for this. But when I see a guy who comes in saying my penis is shrinking, I'll just take the fat and push it back and go, nope, you're not. It's the penis is, you're fine. Like, you're just getting fatter. I mean, for lack of a better term. So yeah, I hear that all the time.
There's also the thing that a lot of guys don't realize is sometimes they're, you know, they think they have good erections, but the erection's only like it's 70 or 80% or whatever it is. And then they get their hormones optimized, be it cream on the penis or wherever else, their hormones are getting better. Suddenly their erections are way better than before. And they're just that much harder, that much more full. And it's like, wow, look at this. It grew. No, it didn't grow. You're fuller and you're more erect, you know, so keep that in mind. But you see a lot of weird stuff at your clinic. Do you ever see guys that actually injected testosterone into their?
I have not, thank goodness, not yet. I've read about that, and that can't be that common. I mean, I know there's gullible people where like guys on forums will say, yeah, just put it in your penis, like being smart, and somebody will do it. I have not seen that, thank goodness. I've seen a lot of weird stuff, people putting things in their penis, around their penis. I've fished a lot of foreign bodies out of penises, but not there. Yeah. A whole separate topic. I have pulled razor blades out of the urethra. I've pulled e-cigarettes out of the urethra. Guy has put telephone cord in his bladder, copper wire through the side of the penis, all kinds of stuff, man.
What was anyways,
different topic, but they're just, a lot of them are actually prisoners, and they'll put things in their urethra just to get a trip out of jail. I mean, it's actually very sad. I mean, they'd rather do that so they could get out of jail for a night, go to the ER, than be stuck there. Yeah, it's bad. So, my wife recently, I mean, a guy had left a cock ring, a metal ring around the base of his penis for 24 hours, and everything swelled up, and she had to get the ring cutters that the orthopedic docs use to cut rings off, and cut that off when she was on call. So,
ouch.
Guys need to be careful with doing some of this stuff. I mean, it's not the favorite call your urologist wants to get. I don't have a lot of sympathy for guys who've left a ring around their penis for 24 hours, and I just don't. I mean, we'll take care of you, obviously. It's just, come on.
But in your mind,
that's the way to make your penis bigger. Just strangulate it with a penis ring and cock ring, and it'll get bigger from lymphedema, and then you're in for a world of hurt. So,
you poor guy. I'm gonna stick to IUT.
Okay.
Next one. TRT causes heart issues.
Oh man, that's a whole. We probably need to do a whole video on that. So there were, I think, 4 studies they've pretty much been refuted as far as they were very poorly done, showing an increase in cardiovascular events. And this was years ago, and that's what everybody latched onto at the time. I think that's why the FDA came out with their black box warning in 2014 or 15 about, and then right after that, all these studies came out showing the opposite, and they were much better done. And since then, I mean, there's tons of studies showing it's the opposite. Low T can lead to heart issues, cardiovascular issues, endothelial damage, all the stuff we've talked about. Part of it's from low estradiol, actually. It's all of it combined. Testosterone seems to be cardioprotective. If they're even giving it to guys with active congestive heart failure to help cardiac contractility. If guys have an MI when they're on testosterone, they're more likely to survive their heart attack. There's just a plethora of evidence now that just, and I read a good paper the other day. It was good and bad, because at the end they started talking about coming off your TRT, which is mad if it gets over 54. And I was like, God, but other than that, it was such a good paper. It was on erectile dysfunction and cardiovascular disease and TRT. And they went through those studies, the old ones, showing kind of how bad they were. And then they listed a lot of the newer ones. I'll try to find that paper and post it in the group if I can.
Absolutely.
Yeah, there's tons of studies now. It just doesn't add up. Interestingly enough, I saw a guy this week. He's 43. He's already had a heart attack, and his testosterone was in the hundreds when he had his heart attack. And thankfully, he had a good cardiologist who told him, this likely contributed to your heart attack. You need to be on testosterone. And I was like, holy cow, you need to find that guy and give him a hug, because most cardiologists say the opposite. Most cardiologists will still tell people, you got to come off your testosterone. It's going to kill you. Here's a stat. And so it's rare to find cardiologists but it's true. He knew the research, and he wasn't quite dialed in. That's why he came to see me. He needed to be dialed in better. But just the fact that people are acknowledging that is a big deal. And so I stress that in my practice all the time. I mean, I think it's becoming more accepted now to even screen men for low T, not just based on symptoms. If they've had heart attacks, if they're insulin resistant or diabetic, super obese, a lot of these guys, I mean, there's even papers on this, like screening guys that are obese for low T, because it helps with their obesity. It helps with their diabetes. I'm like, yeah, if I screen a guy and he's in the 200s, 100s, he needs to be on testosterone. I don't care what his symptoms are. He doesn't even have enough estradiol to protect his blood vessels.
Yeah.
So yeah, that's a bad one. There were some people that posted studies where they're like, oh, this guy was given testosterone every 3 weeks and had more cardiovascular issues.
Duh.
Yeah, and we talked about that in the.
Yeah.
Well, yeah, he's on every 3 weeks. He's actually being castrated with his testosterone, so that doesn't count. So.
For you guys wondering what we mean by that, is like he'll have decent levels for a week, and then the next 2 levels he's got almost nothing. So he's actually deficient for 2/3 of his life.
I've seen it over.
Doesn't work that way.
Yep, I've seen these levels where their docs will check them at the end of the 3rd week, and they're in the less than 100. I mean, it's unbelievable. So that's a bad protocol, guys. Bad protocol.
Yeah. If you guys out there actually believe for 1 second that having your estradiol and testosterone low will be safer for you long term than getting both of those levels up. And when I say both, again, testosterone and estradiol, you're gravely mistaken. Keep those low levels and give me a shout when you hit about, 60, 70 years old, and then we'll talk.
Yeah.
Next one, docs that say that TRT is qualified strictly based on lab work. If you're 450 and you got some symptoms, it's not testosterone. It's not that. It's something else. It's not that.
I hear it all the time. It's just not that simple. The lab work obviously doesn't tell the whole story because, number one, what if that guy 10 years earlier was at 1,500, 1,600, and that's where he felt great? Number two, there's issues of androgen resistance where the numbers may even look fine, but their receptors are being clogged up with, all this crap we're absorbing, EDCs. And I'm a believer in that. We need more research on it, but it's coming to light. The main thing is the symptoms. And even Dr. Morgenthaler has talked about this, thankfully, who's a prominent urologist in the research side of this up in Boston. And talking about treating men based on symptoms and not just numbers. He's done some good work showing that the lab results are not always accurate. There's so much discrepancy in what the labs show, and symptoms seem to matter more. Granted, if a guy has these symptoms and his levels are 1,000 and you put him on testosterone and he still has the symptoms, yeah, his problem probably wasn't testosterone. But I see guys all the time, and I think there is benefit in checking the free testosterone as well. And there's papers on this. The Endocrine Society recommends only checking a free T if they're borderline normal, and then there's still something off, then check it. I see guys with testosterone in the 500, 700s, and their free T is like 5 nanograms per deciliter. So you can't just base it off labs. And, I have yet to see a guy that has a free T of 20 or 25 naturally. Obviously it's selection bias because the guys that are coming to me that we're checking are symptomatic. So I'm sure there are guys out there that probably do have it. Just like you don't see guys anymore with a total testosterone of 1,500. There are a few. You'll see them. And I think I made a post about this, and this goes in with our topic today of dumbest things seen lately. So my friend, who's a urologist down in Victoria, Texas, he called me up and he said, "You're going to love this because I know how much you enjoy testosterone." And he was referred a 71-year-old male for hypergonadism. The guy had hypergonadism. He had a testosterone level of 1,500, not on testosterone. That was the consult. And my friend was like, what am I supposed to do with this? Am I supposed to castrate him now? He feels great. He's got a normal T and it just shows it's legit. And that's why, normals used to show that, and there's still people out there. And this guy's he must be, we need to study him and see what's going on. I don't know why he's so healthy, but it's like, he felt great. And he was like, get out of here. What a wasted visit. And it just pissed me off. It's like doctors are so terrified of testosterone that they would send somebody to a specialist because their testosterone was 1,500. Like I said, they should have been asked this guy, what are you doing? Like, what are you doing right?
Yeah.
Even him, he may not have felt, he felt great, but there could be guys that are 1,500 that don't feel well. But again, it's just one of those things. You can't base everything off labs. When we treat guys that they're symptomatic, fairly low free T, you get them on testosterone, they feel better. And that's the goal. It really is. I know that sounds crazy, but the Endocrine Society guidelines, and that seems to be what everybody uses, they're just not up to date with this, honestly. And most guidelines are not up to date. They're taking a lot of old stuff and trying to just get the best practices. But that's why, and I've mentioned this in multiple videos, and I've posted the paper before of Dr. Morgenthaler's recent response to the AUA guidelines, American Urologic Association guidelines on low T, and questioning. And a lot of it was about not just going off of numbers, but using symptoms. And I think that's a good sign. I think things in the next 10 years will hopefully go more that direction. But it irks me when people get so focused on the lab ranges. It's the same thing when guys get focused on doses and they'll say, oh, anything over 200 milligrams a week is a steroid cycle. I mean, I'm sure that's probably on the list for today, but we can talk about it now. I mean, I hear that crap. I see it all the time.
Every time I tell anybody about my dose, I'm on 250. Yeah. 250 gets my total to 1068.
Yeah. I mean,
1068, it's nothing. No. I need 250. Oh, you're taking steroids.
Yeah. I see that more on the bodybuilding forums. Guys just say that, and I don't know where they come up with it. It pisses me off. Like, you have no idea what you're talking about. I mean, most guys only need 150 to 250 milligrams a week, somewhere in there, most guys, to feel better. There are outliers. There are guys that only need 100 milligrams a week total to get symptom free.
More than me.
Yeah. I had a patient recently who was he's a big guy, 300 milligrams a week. He was only in the 700s, and he still wasn't feeling like, he was feeling a little better, but he's like, there's still some of this stuff. He's not a bodybuilder. He's not trying to like abuse anything. He just wants to feel better. I put him on 400 milligrams a week. That's the only patient I've ever done put on 400 milligrams a week. But yeah, people would look at me and say, oh, he's just prescribing steroids. No, I mean, I'm trying to get him where he feels better. And if he needs 400 a week to get his levels to 1200, 1500, whatever it is where he's going to feel better, that's okay. It's not, and doctors should know that. They know in other medicines that there's no one size fits all dosing for people. So I don't know why it's become such a thing with testosterone, but there's just a taboo. You know?
I find a lot of the confusion comes from, we're saying you want to treat the symptoms and not the numbers, but then we bring up the numbers. But the numbers, and I just did a video about this, guys. If you watch the video I did, I think it's Stephen entitled it "Best TRT Protocol." It was just done a couple of days ago, actually. Basically, guys, the numbers are basically a guideline, but it's not the be all end all. Okay, it's not like, we say guys are better at, a lot of guys get better when their free T hits above 30. So automatically it's like, oh, I'm at 15, so I should target this range. Well, no, you're not targeting that range. You're treating symptoms, and you're like, yeah, but if I'm treating symptoms, then there shouldn't be a range. Yeah, but most guys are in this range. So it can get confusing to some people when they're just starting out. Well, should I be trying to get there because that's where most guys feel better, or should I be ignoring it? But you're just using it as a very, very loose guideline. So if your free T is 12, and that guys are feeling better between 30 to 50, that, chances are I could probably raise my dose a little bit more and maybe get a little closer there and see if I feel better. But you're not targeting the number. So that's an argument that a lot of people hit us with, saying, you keep talking about numbers, but then you're saying ignore the numbers. And I agree, it does sometimes come off as confusing. You're using it as a very, very loose, general kind of guideline, as some kind of an indicator where an ideal might be, but it might not even be it for you, because there's guys in the group that are taking 5 milligrams a day and they're saying, I'm great, but they're the outliers. So
yep. I've seen guys with a free T of 18 and they feel great. Like, okay, I don't try to get them higher. I mean, if they feel better, and I have a lot of guys that are like that. So the reason we talk about the numbers is just people ask and they want a statistical, bell curve. So you can just say, yeah, this is what we see, but that doesn't mean that's where you need to be.
Yeah.
And I get that question all the time, messages saying, does this lab look good? And I can say, well, it looks like the number I would expect based on your dose. Like, yes, I can tell you that, yes, you're absorbing it right, or that's a normal number for that dose you're taking. But what matters is, I always say, how do you feel? I mean, and that's it.
Yeah.
Yeah, I feel pretty good, doc. I'm sleeping better. I'm working out better. My libido's improved. I'm like, write it out. Stick with it. You're good.
That's it.
Yeah.
That's what else you do.
Yeah. Just take it. It's your vitamin every day. That's what you're taking.
Yeah.
Go about your life. So.
Okay, we'll hop on the next one. I stay away from TRT because TRT has harsh side effects, unlike clomid monotherapy.
Oh my gosh. Yeah, we need Gil here to help with this one. He gets real feisty about clomid. Man, that's somebody trying to sell you something, honestly. I don't know.
Guys, to any of you that are either have symptoms of low testosterone or have measurably low testosterone, and say you're in, I don't know, you're over 25, don't even bother with clomid or tamoxifen or or these things. Don't even bother with them. The more doctors I speak to, the more they are telling me that they get a lot of their patients on these things just to cover their ass. Mm-hmm. It's really just to cover their ass, to say, listen, I've done everything I can to give this patient something that'll boost his natural levels. And then when we tried and it didn't work out, because it rarely ever works out, I've now exhausted all possible options. So now I can put him on TRT, but I did try everything else first. It doesn't work nearly as well. Now, yes, if you're a teenager and you've got very, very low tanked testosterone levels, okay, fine. They might try to find something. But if you're over 25 or whatever, I mean, don't even waste your time. Just don't do it.
Yeah, I would say I wouldn't base it on an age. I would base it on fertility concerns. Because there are some guys, like I've got a guy that's been messaging me, nice guy, and he worries he may have been put on TRT too early for whatever reason. And he's 27 or 26, and he's asking about a clomid or tamoxifen restart. And I kind of went through everything with him. His pre-numbers, pre-TRT, his LH was 6. And I was like, well, that's already middle of the range to high. You may not respond to a tamoxifen or clomid restart no matter what you do. You're probably going to feel worse when you do it. It's probably not going to work. But I was like, it's shared decision making, like we do with all our patients. It's, if you feel more comfortable trying it, that's fine. Just here's what to look for, and it's probably not going to work. And it's rare that I do this. I mean, I haven't done it with a single patient since I've been here almost 2 years in Paris. I had a couple guys when I was in Shreveport who it was a fertility issue. And I got this one guy, he was 25. We got him on clomid every other day for 6 months. His levels got up to 1,200. He felt no better. But for him, I think when he came off the clomid, his levels did remain higher. And so for some guys it can work. And I think it's only really beneficial for guys that are either just overly anxious about staying on TRT forever, like maybe they got put on it too early, or they want to do everything they can not to hurt their fertility chances. Let's say they've already been trying to have kids and they've been having trouble. And that's where a lot of the fertility docs will use the clomid. They're also using Arimidex and AIs for this, and that's insane. I mean, if you're going to do it, do the SERM. Don't do an aromatase inhibitor, please.
Or something like HMG, which we know.
That's the other thing is they could do testosterone with HCG and then HMG if needed. I mean, there's tons of different options, but as a cookie cutter thing, like, oh no, you got to try clomid first. That's insane to me. It all depends on the patient and what their concerns are, what their physiology is. Like I say, if they already had high gonadotropins, they're not going to respond probably. I mean, there's studies showing that if their LH is over 6, the likelihood they're going to respond to a restart is very low. You may just be spinning your wheels and feeling worse, for 6 months when you don't have to.
Yeah. So, so if you guys think that TRT has harsh side effects, go try clomid for a while, and then you give me a shout and you let me know how it's going for you.
Absolutely.
And if you're going to avoid TRT for fertility, I'm telling you, you can be on TRT if you have low levels and do things for your fertility as well. There are ways to do this. Saying I'm just going to get off my testosterone so I can be fertile, well, now you have virtually no libido, virtually no erection strength. So how are you going to get this job done exactly? And the sperm count might not necessarily come back on its own. There are things that can be done.
Yep. And you can always freeze. I always recommend guys, if they're younger, and to freeze their semen ahead of time before they start TRT, because at least you get that backup just in case you needed to do that one day.
Yep. Absolutely.